Hi everyone. So we're going to continue our discussion now. We will in basic infection control 3 now point 2. 3.2 na tayo lahat. Okay. So congratulations for those who have made it to the return demonstration of BIC 3 plus of course your oral examination. Were you able to answer questions thrown to you by, of course, yours truly? So hopefully you have understood something about our discussion, and hopefully you're going to have it for life. Huh? I'm expecting that you wouldn't call me anytime overnight, or let's say in a day wherein I'm so very much busy, asking me as to how to perform things or procedures for your client. So basic lang. You just remember that you can do it yourself, and of course with the knowledge we have given you, and of course you have to develop that confidence, great confidence in you to shine as a caregiver. Again, we are now at basic infection control 3.2, and this deals with our bandaging and your stockings plus the tubings. So we're going to start. Before anything, wala pa na ako napindot, click like and subscribe. Okay, thank you. Okay, so we're now at your circulation. So ways to improve circulation, we have your moving, of course. So when you're going to move, you're improving your circulation. So what do you mean by circulation? It is the flow of your blood inside your body that it's referring to your circulation. So that's why if you're going to move, if you're going to exercise, and of course do some deep breathing and coughing in your lungs, so you're encouraging circulation also. So never dislodge a thrombus causing it to travel to vital organs or by having a massage. They said that you should not massage the front part of the body because you have plenty of blood vessels there. The front part, because you have plenty of blood vessels there that could be dislodged. Okay, traveling clot that might be dislodged if ever. Called we have your thrombus. Okay, they're called thrombus. So, di ba, in our injection, we have there, you should prevent air from entering inside your needle, or you have to remove it out before you're going to perform injection, because to prevent air embolism or traveling air inside your blood vessel. So, Mona, you have to prevent that from occurrence. Now, we were going to prevent now the thrombus or traveling clot. So, that is your thrombus. Isa is thrombus. Pag duha, trombi. Okay. Pag duha, trombi. Di ba? The plural form, the singular and plural in our English. So, anti-embolism stockings are used as elastic stockings worn to prevent the formation of blood clots in the legs. Okay. So, when are you going to develop this one? For example, if you're working as a teacher like me, you have to stand the whole day, di ba? If you're going to stand the whole day, you have this tendency to develop um poor circulation in your legs, because remember in our discussion, in your from the heart, the blood will going to go to the rest part of the body, including the legs, carrying now your oxygen. But this time you have worn it out because you keep on standing. That is why after the cells have taken all the oxygen given or from all oxygen from your lungs to the heart and to the circulator to the external part of the body, there's a tendency that you have already worn it out. But the problem was you cannot the blood cannot go back to the heart and to the lungs because you keep on standing. It may have this. It can go back to the heart and then to the lungs for asking for oxygen, but it undergoes this what we call the hard time to go back because of your type of work that is always standing. So because of that, you have this poor circulation. So there's a tendency that you mangangalay yung paa mo, masakit. Bakit masakit? Kasi poor circulation nga. Hindi nakabalik yung mga blood na wala ng oxygen para manghingi ulit kay lungs ng oxygen. Do you get me? Again, in our body, we need oxygen, di ba? If we need oxygen nga. If we need oxygen, so who supplies oxygen? It is our lungs, okay? So how can lungs supply oxygen? Of course, to the food that we have eaten, okay? So there will be adequate supply of oxygen that our lungs were going to have or to produce. So from the lungs, the blood will going to go to the heart, and then to the heart, to the rest part of the body, including your legs, or in this top part of the body, the arms, and then the legs, to supply our cells with new oxygen. For example, if there's a wound there, to supply our cells there in that particular area with the wound with new oxygen, thus promoting what we call as your wound healing. Pero kung wala, so the oxygen plus the nutrients will just go there to the distal part of the body to the farthest part of the body to supply oxygen. Kaya pag hindi, syempre, your cells were going to ask for it, and they were going to suffer from if it won't be if it won't be fed with oxygen or other nutrients, of course, kung sa kuan pa, kung di naman pa kaya, magbubot-bot siya. Magkuan siya nga naman yung ko ikaon. So, kapuyon, they were going to experience fatigue and all. So, dapat supply good mo siya with all the nutrients plus oxygen. The problem was, because of your lifestyle, I mean, you're always standing the whole day, so there's a tendency, the oxygen, the blood without oxygen, because it was already taken by the cells in your legs or in your feet. Tapos nilang kung kinain yung lahat ng oxygen na binigay mo, bumalik naman yung blood now. So, saan po siya na dumaan? Normally, sa arteries po siya dumaan with oxygen. Pag walang oxygen, bumalik siya. Sa vena siya dumaan yung dugo na walang oxygen. Babalik naman siya na sa heart mo. Then, to the lungs, asking for oxygen. So, that is now what we call as the exchange of gases, which we're going to deal with it after, during our human anatomy module. So, if that's the case, you're going to get some equipment, or let's say an aid to keep your to push the blood to go up inside, to go up from your legs, to go up to the upper part of the body, then to the heart, then to the lungs, and ask oxygen. How are we going to do that? By using anti-embolism stockings, and of course, it will very much helpful because this is the stockings that create pressure on the leg veins, increasing now the blood to go back to your heart. Do you get me? So, stockings po na to, anti-embolism stockings. They're going to push now, siyempre, they're going to hold your feet, right? So, they're going to push now your vein so that the pressure applied on it, we're going to increase now the flow of your blood back to the heart and then to the lungs to ask for oxygen. Do you get me? Wala mo makatubag. Kaya nga naman. Ako naman si Yoyo kay video money. Char. Okay, diba? So, that's the explanation. So, I'm going to give you that as a quiz, ha? So, this is a picture of your anti-embolism stocking. So, you have seen the picture. Meron po siyang stocking po siya, pero yung foot niya po ay nakalabas, yung paa. So, bakit nakalabas siya? That is to check your circulation if it is not too tight or too loose. Dapat ganyan siya. Hindi po well covered yung foot, ha? Anyway, very, very stretchy siya, pero of course, medyo you're going to have a, what we call this one, not that a problem, but you will feel uncomfortable if you're going to wear this. But it is for their own good, diba? Just like nurses, you're wearing stockings, although they are not anti-embolic, but there are some more wearing anti-embolic stockings. And of course, it will going to prevent varicosities because if blood cannot go back easily, so it will going to make your vein inflame, causing now your varicose. So, ito po yung itsura ng anti-embolism stocking. Ano niya, yung purpose niya? It will going to create pressure in the leg veins, thus increasing now your blood back to the heart. Okay, the increased pressure, we're going to push your blood back to the heart. Okay, for clients who wear elastic stockings or bandages, we have to check the toes as we have seen in the picture. Hindi po kasali sa paa. For example, this is the paa. Hindi po kasali ito, yung mga fingers or mga toes niyo po. Check with the client to see if he has any complaints of numbness, pains, and tingling sensation. Kasi if it happens, of course, the client feels uncomfortable, that it could possibly impede the circulation now. So the stockings doesn't serve its purpose. And you have also report abnormal observation to your supervisor. What are abnormal observation? When the client is a foot of the or the toe of the client is what we call this one, ito. Pag ito po yung mga toes niya po ay there will be cyanosis. What do you mean by cyanosis? There is bluish discoloration of the skin. Bluish discoloration of the skin evident with the legs without oxygen. So pag may bluish discoloration na yung skin mo, meaning the stockings are very tight. So very tight po siya. So, it doesn't serve its purpose na. And we have also, for example, if you're going to feel the foot of the patient, it is cold, and very cold and then very cold and clammy, maginaw po siya or bugnaw, marpatay. So, meaning, there were no oxygen present anymore on that area. Meaning, kahit yung arteries niyo po, wala na po siyang oxygen. Kahit to the extent yung mga cells niyo po is deprived na with oxygen. So that is why naging cold and clammy siya when you're going to feel it. Plus, there will be cyanosis in the area, so meaning there is no oxygen anymore. And then we record what you have done. Okay, so those are, you have to check the toes. Then we have fingers for coldness and bluish skin. Again, what is this particular statement implied that if there is bluish skin, there is cyanosis, and if there is cyanosis, there will be lack of oxygen, and there will be lack of oxygen. So meaning if there is no oxygen, meaning the area in your foot are not fed anymore. Hindi po siya nakakain ng oxygen or ng mga nutrients. Okay, so that is what you're going to do, especially with stockings and plus your bandage. I'm going to demonstrate tomorrow the application of your bandage or your ACE bandage. Functions of your elastic bandage is the same with the elastic stockings, but in addition, elastic bandages are used to support and reduce swelling after musculoskeletal injuries. So there is specifically a specific function of your elastic bandage, that is to prevent to reduce swelling after musculoskeletal injuries. This can be applied in your arms and your legs. And make sure when you're going to apply it, you're going to have it in a figure 8 motion. And make sure also that the elastic bandage will going to serve its purpose, that is to reduce swelling. So I'm going to give you a picture of that. Okay, ito po. So yan. Yan po yung elastic bandage. Diba? You can purchase that in the pharmacy. Diba? That is, remember the toes that you hear, the toes are still not wrapped with your bandage, because that is to check for your circulation. If it's too tight, then if it's too tight or if it is deprived with oxygen, not the vein, the arteries and the cells are deprived with oxygen, so you're going to feel it. The color is cyanosis or bluish discoloration as evident with no oxygen. And of course, you're going to feel it. It is cold and clammy. Maginaw po yung paa. So, wala na po si oxygen. At kung wala oxygen, walang nutrients na nakukuha si cell. Ang mga cell mo po sa paa nyo. So, tingnan niyo yung pagka-bandage. It is nicely and neatly done. Okay, so these are the bandages that you could have. You can purchase it by size or in different sizes. So guidelines, use bandages of proper length and width. Of course, pag malaki yung injury, malaki yung paa, so syempre yung malaking bandage ang dapat mong bilhin. And leave furthest part of limb exposed in order to check for proper circulation, as what I have mentioned kanina. And keep limb elevated while applying bandages. So dapat naka-elevate mo yung limb. What do you mean by limb? Yung paa or yung kamay? Okay, that's your limb. And then we have also wrap evenly with no wrinkles or folds. So it should be nicely and neatly done. Do not wrap too tightly, because if you're going to wrap too tightly, so of course you're impeding the circulation. So it won't serve its purpose to reduce swelling, diba? Caution, apply as ordered by the physician, doctors, or nurse, and then or therapist. Apply firm and with pressure, not tight. Pressure lang, but not tight. Check color and warmth of exposed parts periodically following application of bandage. So, dapat, di ba, color. So, dapat walang cyanosis, walang bluish discoloration. Warmth, dapat hindi cold, kundi warm. Use clean bandage. Oh, di ba? Specific yan. Dapat laban din natin si bandage. And of course, do not share your bandage to your neighbors. Why? Because they were going to suffer from itchiness. Because of course, if you keep your bandage to your bowel, so it is not attractive to insect and your dust, the moment they're going to apply it, they're going to suffer itchiness. Apply bandage diagonally across the leg to prevent cutting of the circulation. Okay, dapat across po siya. So, pa-diagonal. Pa-diagonal siya, hindi pwedeng basta lang across, diagonal, para hindi po ma-impede si circulation. Apply the bandage in a figure 8 or spiral pattern. Remember that here, apply the bandage in a figure 8 or spiral pattern. Okay, next. So we're done with it. So we're going to have a question and answer portion tomorrow with your bandages. And of course, now we are at catheters, tubes, and tubings. I'm going to show you this one tomorrow also. So purposes, we have inserted into a natural cavity opening to draw fluids or gases out of the body. Okay. So that's your catheters and tubings. Example, catheters. So that is to draw your urine, diba? And tubes, we have also, if you're going to apply it in your nose to your gut, that is your NGT. And then we have also, if you want to do some suctioning, that is also you're using a tube. And your tubings, that is your IVF or intravenous fluids. So, to put foods, fluids, or gases into the body. Yes, of course. Another, if you're going to have we call this one ultrasound, you're going to use a tube. Endoscopy, you're going to use a tube. But that is not the function of the caregiver. So as a caregiver, you probably will not be required to insert tubes or catheters. However, you will be working with patients with tubes and catheters in their bodies as part of the treatment, and therefore, you understand the reason for using this kind of equipment. Dapat lang. Kasi naman, syempre, you're dealing with client. So, hindi mo alam kung anong problema ng client, future problems niya. Pag na-hospitalize siya, so dapat siya i-catheter. Pag na-stroke siya, dapat siya i-catheter para mamato ang INO, di ba? Or intake and output in your elderly. So, dapat talaga, you have the basic knowledge about this. Okay? So, now, we have definitions. The tube is a round cylindrical hollow piece of rubber, plastic or metal or a glass. So that's your tube. I'm going to show some picture, some picture of it, and of course you're going to have it tomorrow. But what I have is NGT tube plus suction tube lang po sa school. And in the catheter, a special kind of tube that usually have several openings at one end. So we have here several openings at one end. Kasi may port for the balloon, port for the urine, and sometimes in a three-way catheter, you have also port for the fluids. Okay. This is your catheter. Ito one. Tingnan mo, may balloon siya, diba? So, dalawang port niya. Ito po port o labasan ng urine, at ito yung port for your balloon para ma-inflate si balloon. So, as you can see, yung dalawa. So, by sizes po siya. The bigger the sizes, the bigger the number, the bigger the size, or the bigger the lumen. Now, now we have three-way catheter. Nantok na ako. Three-way catheter. So, tingnan niyo po, 1, 2, 3. Ito pa may red, pang balon po yan. Para ganito. Ito yung isa, pang urine po yan. Labasan ng urine. At ito rin yung isa is for fluids. Oh, i-attach siya sa mga IVF. What yung IVF? Intravenous fluids. Bakit i-attach siya sa IVF? For example, medyo mabato yung gallbladder, yung urinary bladder niya po. So, kailangan niyang i-blasting. So, dapat i-destroy or i-liquefy yung bato sa loob ng urinary bladder niyo. So, but in that case, okay, a fluid will going to enter inside your urinary bladder in the form of your IVF through a three-way Foley-bag catheter. Three-way po siya. Bakit three-way? Bakit three-way siya? So, we have 1, 2, and 3. Two-way po ito isa. So, 1 and 2. 1 and 2. So, two-way. Okay. The other one, yung single lang po, that is your straight catheter. Okay. Okay. And then we have here your tubings. So, dito po, tubings po to NGT tube. So, intravenous tubing, tube pala yun, ito tubing. So, intravenous tubing is used a great deal in the hospital to insert fluids such as blood or medications into the patient's body. It is used for patients with many different kinds of illnesses and conditions. And it is also one SOP po siya pag na-hospitalize ka, dapat i-IV ka po. Kasi po in case of emergency, pag dapat mag-administer ng drug na kailangan madaliin, dapat may IV tubing. Kasi dito lang po i-insert yun. So, mag-IVTT ka. Anong yung IVTT again? So, intravenous transfusion therapy. Okay. Report the following. When you can't see drops of solution passing on from the bottle into the tubing. Okay, I'm going to discuss that tomorrow. But there is still some solutions in the bottle. So, pag walang tulo, so you have to report it. Possibly, na-dislodge po siya. When the gas part where the drops come through is filled with solutions. So, pag filled with solutions, walang air, so hindi na siya magda-drop. So, kailangan i-remove po yung, dapat half lang po yung laman ng chamber. And then, when you see blood into the tubing and then at the needle end, so dislodge po kasi may blood na. So, the fluid becomes infected. When all the solutions has run out of the bottle and the bottle is almost empty, of course, you have to replace it or to do some follow-up. When the patient complains of pain and tenderness at the place where the needle is inserted. So, pwedeng dislodge na yung needle. Okay. And when you notice a log peel raised or inflamed area of the patient's skin near the place of where the IV is inserted. So those are the things that you have to refer or report it to the physician or doctor. So here is the picture. So I have given you picture po yan ng IV tubing. Sa IV tubings pala yung isa. So next is the nasogastric tube. Ito po yung sinabi ko sa iyo na mag-demo tayo bukas. So, nasogastric tube is given this name because it is inserted through one of the patient's nostril, okay, called daso. And then it is passed down to the back of the patient's stomach called gastric. Okay, muna na nasogastric tube. Rules: never pull out of the tube when moving the patient or changing his position. You have to prevent from pulling out the tube of your client. Remember to repin the connecting tube into the patient's clean down after you have finished bathing him, or repin the tubing to the bedclothes when you have finished making the bed. So that's it. So those are self-explanatory. Basta i-repin. If your patient complains that the tube irritates his nostrils, you may be instructed to use a lubricant in the nostril. Pag sabi niya makate, so use some lubricant. And if the patient begins to gag or vomit while the tube is being placed, report it to the head nurse right away. What do you mean by gag? Nagtikuka siya, so you have to report it right away. Okay. Now, we were going to have the nasal cannulas. Nasal cannulas or tubes are used to give oxygen to a patient. So, I have also a picture of your nasal cannula. The cannulas are inserted in the patient's nostril. They are used when the patients need an extra oxygen, not and not when equipment must provide a patient's total supply of oxygen. So, extra lang po na oxygen. Hindi po siya nag-provide ng total supply of oxygen. Still, the patient should breathe by himself. On film such time, pwedeng available pa po si oxygen. Okay. Now, we will go into nasal oxygen catheters. This catheter is a piece of tubing that is longer than the cannula and is inserted through the patient's nostrils into the back of part of his mouth. The nasal catheter is more effective way to give oxygen to the patient than the nasal cannula. The nasal catheter is used when the patient must have an additional amount of oxygen at all times. It is more effective than oxygen tent or oxygen mask and is less likely to frighten the patient. So, bakit? Kasi nga, maliit lang po siya. Yung nakalagay dito. Okay. So, for us to remember, because oxygen is being used, be sure to observe all fire regulations in effect to the hospital. Dapat may no smoking sign ka po doon. No smoking via smoking daw. No smoking beyond this point. O, parang ganun. No smoking sign. And dapat walang magsigarilyo po siya talaga sa room. And then check the flow meter, a piece of equipment that shows the rate at which oxygen is being given to patient. So, we're going to show you that tomorrow, the flow meter. I guess I don't have that one. I'm going to purchase for that one. With the nasal cannula, the reading can go up to 10 liters per minute. With the catheter, the reading should not go over 6 liters per minute. So, you remember that ha? Pag cannula, not go more than 10 liters per minute. But pag catheter, it should not go over 6 liters per minute. The tubing connected to the source of oxygen should be pinned to the patient's gown or bedclothes. This helps to keep it in place and will prevent injury to the patient's nostrils if the tubing is accidentally pulled out. Make sure the tubing is not kinked. O, diba? So, hindi po siya tupi. Okay. It should not be under any part of the patient's body para walang obstruction yung oxygen flow. This might slow down or stop the flow of oxygen. A humidifying jar should be used with both the nasal oxygen cannula and the nasal oxygen catheter. The water level in the humidifying jar should be kept high enough so that it bubbles as the oxygen goes through it. So, dapat yung po sa humidifier, may bubbles po siya kasi pag yun po mabibigay ng fluid, so humidified to oxygen. Kasi dry po si oxygen eh. If the patient's nostril becomes irritated, you may be allowed to apply a water-soluble lubricant on it. When the patients no longer need the additional oxygen, the supply should be cut off and should be removed by a doctor or nurse. Okay. So, diba? Ma'am, kailan po namin i-remove kung kami yung mag-remove sa oxygen? Pag the patient is already declared dead by the physician, you could remove the oxygen yourself and even bath the dead body. Okay. So, those are all again when it comes to our BIC 3. And thank you very much. Don't forget to like and subscribe in this video so that I could do a live broadcast. Okay, those are the things that we need to discuss. And tomorrow, we're going to have a quiz. Okay, so good night, everyone. Love you.